Well,
noches
good
a todos los que
morning, good
están en la sala en este
afternoon,
momento.
good evening to
Primero
everyone
que
in
todo,
the room
quiero
today with
que
us.
tomemos 30
First of all,
segundos
I would like to
para
ask you to
estar
take 30
en
seconds
solidaridad con lo que está pasando en
in
este momento con
solidarity
las
with
personas
what
de
is
Jamaica
happening right
por
now
el
to the
huracán
people
Melissa.
of Jamaica
Entonces, por favor, vamos a
due
tomar
to
30
Hurricane
segundos
Melissa.
en
So
solidaridad
please
de toda la
join me
población de
in taking
Jamaica.
30 minutes of silence, 30 seconds of silence.
Bueno, mil gracias a todos y creo
Thank you
que
so much,
es muy importante
everyone.
reconocer, como lo hemos visto en
It's
este
really
curso,
important
las
to
grandes retos y los
acknowledge,
desafíos que tenemos
as
con
we
los eventos
have
extremos que están sucediendo
seen
alrededor del
in
mundo
this
y
course, the great challenges we face
desafortunadamente
with these
en este momento
extreme
están
events
viviendo
we
las
are
personas
facing
de
around the
Jamaica
world.
en
And
este
unfortunately,
huracán.
the people of
Bueno,
Jamaica are
bienvenidos
dealing
a
with
nuestra
that right
10ª
now.
sesión que tiene que
So
ver
welcome to
específicamente
our
con
10th
cómo
session that
aliarnos,
is
cómo generar
specifically
sociedades, cómo
about
generar
partnerships,
colaboraciones para proteger
how
la salud
to
frente, digamos, a
build
este
collaboration
problema
to
que tenemos
protect
frente,
the
digamos, a los
health
desafíos que nos
facing with
eh,
the
enfrentamos con
challenges
el proceso del cambio
we deal
climático.
with in this process
Eh,
of climate change.
Como hemos venido mencionando en todas
As we
nuestras
have
sesiones,
mentioned
ustedes
in all
tienen un botón
sessions,
en la parte
you
inferior
have a
de su
button on the bottom
equipo de interpretación
of
para los que
the
quieran, digamos, hacer uso de
page where
ese
you can access the
elemento.
interpretation
Como les mencioné, estamos entonces en la sesión
for
10 y es la
English,
sesión penúltima
Spanish,
de este
Portuguese, and
curso, o sea, ya
French.
estamos
This is
casi,
the
digamos,
almost
para terminar
the
y estamos
last
muy contentos de
session.
tener, digamos,
We
esta
have the
gran
last one on
acogida
Thursday, and we are very
para las
happy
Américas.
with the
En este
participation
momento,
we have had from people throughout the
como ustedes
Americas.
saben, los
As
objetivos
you
del
know right now, the objectives of the course,
curso, que creo que ya estamos en el curso, tiene que ver
of
con la
course,
importancia de ampliar rápidamente la ley de
we
adaptación al cambio climático, pero también para
know
preparar a las personas, las
about,
comunidades y los sistemas de salud
understand the importance of
que
rapidly
los impactos más graves
scaling
que se
up
esperan
climate
con el cambio
change and
climático.
health adaptation
También describir
actions
las
to
medidas
prepare
claves para ampliar la
individuals,
adaptación.
describe key actions for scaling up health adaptation. identify opportunities for increasing health adaptation efforts, and finally, to be prepared to work with a broader range of partners to address current barriers to health adaptation. Apologies, the original audio is cutting off a bit. And the objectives for today's session are four. We have to describe partnership strategies that effectively engage civil society, non-governmental organizations, and community groups in scaling up efforts to support and leverage local leadership to drive health adaptation, scaling up from the community level, create reciprocal support mechanisms where government and civil society partners mutually strengthen each other's capacity for health adaptation, and to design collaboration frameworks that maintain momentum and accountability across diverse partner organizations. We, as usual, have a 90-minute session. We're going to have presentations and a Q&A section. At the end, you can write your questions throughout the webinar in the Q&A button that is at the bottom of the page. As you know, all resources and recordings will be available a while after this webinar in the website. Just a reminder that attendance is counted automatically when you join with the email address that you enrolled. YouTube views do not count as attendance, and you need a minimum attendance in order to obtain their certificate. We are approaching the end of the course, so let me remind you about the exam. You will receive an email link on the last day of the course, the email with which you registered for the course. In order to answer the exam, there's no time limit, but you should do it in one single session. And the certificates will be issued by December 7th. And please remember to check your email after that date and avoid contacting us before then to request your certificate. For any information, please contact Maggie at the email on the screen. The people who have attended 8 or more sessions at the Zoom platform and obtain a score of over 70% at the exam will receive the certificate. And again, you will receive your certificate at the email with which you registered for the course. Remember that you can use the WhatsApp group for which you can access this QR code. And today we have the pleasure of having these three great speakers. We have Dr. Sherry Lee Harper, Dr. Anna Stewart, and Gislani Mateus. And I will briefly introduce each of them, and then we can go to right away to Dr. Harper's presentation. Dr. Harper works at the University of Alberta and her research focuses on associations between weather, environment, and public health in the context of climate change, and she collaborates with partners across sectors to prioritize climate-related health actions, planning, interventions, and research. She was a lead author on 2 intergovernmental panel on climate change reports, served on the Gender Task Group for the IPCC, and was a lead author on Health Canada's Climate Change and Health Assessment. She currently serves as an IPCC Vice Chair.
La doctora
II, and in this role, she supports II members in their efforts to achieve full and open exchange of scientific information. She's an expert on climate and health in Latin America and the Caribbean. And her research has focused on understanding climate, the environment, and social drivers for vector-borne diseases, and a lot more, of course. And then we have Gislani, who is the superintendent of health surveillance at the Municipal Health Department of Rio de Janeiro. Gislani has worked in public health in the city of Rio de Janeiro for 16 years. She founded and directed the city's Epidemiological Intelligence Center, the first of its kind in Brazil.
We may have lost Hilma. Sherry, you're welcome to start your presentation.
Okay, wonderful. I'm going to try and share my screen. All right, is that working? I don't think I am sharing my screen, am I?
Not yet.
Thanks. Okay, here we go. That's working now, Maggie?
Looks great. Thank you.
Okay, wonderful. Thanks so much. It's such a pleasure to be here today. Yeah, I am Sherry Lee Harper. I live in Canada, Edmonton, but today I'm joining you from Lima, Peru. And I'm so excited to be able to share with you some of the work that we've been doing in the Canadian Arctic that are really, like, partnerships are absolutely foundational to that work. But before I get into my presentation, I wanted to take you to the very tip, the northern tip of the Americas today. And I want you to take a moment to just imagine. Imagine that you don't live wherever you live right now. Imagine that you live in the Canadian Arctic, so way, 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 way up north. And imagine how different it is. Imagine how the landscape is different. Imagine how the ocean might be different. Imagine how the culture might be different. And also imagine how the economy might be different if you lived up there. So for example, imagine that you lived in a community where there were no roads connecting you to other communities. To access your community, you had to essentially fly into it. Imagine what that would mean for things like getting market foods, and that grocery store food has to be literally flown into your community to be able to access things like fresh produce. Imagine the close relationship that you'd have to have with the environment to survive. The winters can be very, very cold, up to minus 50 degrees Celsius sometimes. And all those large bodies of water, all that ocean freezes over, and you can travel over the ice to access different places on the land and the environment, and in the summertime over boat. Some traditional cultural practices still happen. So traveling by dog sled is one way to travel over snow and ice in the winter time. In the summer, all those large frozen waterways, they thaw, and you can access different areas, different pieces of the land, different parts of the water by boat. And the key to survival is this really close relationship with the environment and relying on generations and generations of different indigenous knowledge sources to be able to survive in these conditions. Imagine how the food would be different if you have to fly in market food to go to the grocery store to buy retail foods. Imagine how expensive that would be. And imagine the different types of food you might be eating off of the land and the relationship that you might have with those different food systems and how they're not only important for nutrition, but they also form a sense of identity and culture and pride. Imagine how the water sources might be different. Most communities do have tap water, but when they're out on the land, which can be for several weeks in a row, there's no taps to access water, and people have to get water from other sources. And imagine how fast everything is changing. The Arctic is one of the fastest warming places on the planet. The people who've lived in the Arctic have been raising alarm bells about climate change for decades. And when we look at the science, both indigenous knowledge systems and Western science, we quickly come to the same conclusion that the Arctic has warmed and it's going to continue to get worse. And so, for example, I just wanted to put up here on the slides some of that physical science from Western sciences. This is a figure from the IPCC's Special Report on Oceans and Cryosphere in a Changing Climate. And you can see all the graphs here, but basically what they tell us is that the temperature is rising, the oceans are warming, ice sheet loss is happening, sea ice is decreasing, permafrost is shrinking. And these are all scientific observations, but they're also things that Inuit have been talking about for several decades now. And these impact so many different aspects of Inuit health for those people who live in the Arctic. It impacts nutrition, it impacts foodborne disease, waterborne illnesses, mental health, access to different health services, heat-related morbidity, even though they're in the Arctic, as well as injury and death. And today I wanted to talk about one example in a little bit more detail, which is food security. So we've seen from different research that climate change is impacting people's ability to access food on the land. And this is some research, including some quotes from some Indigenous Inuit elders about how the environment's changing. So people told us about how the ice is no longer predictable, it's not stable, and people don't trust it when they're out on the land. Accidental death has happened in communities, and how when people are going out on the land to access different food sources, sometimes they're jeopardizing their lives going out in unstable conditions. Some other research from Alaska, they did a community-based surveillance program on climate change where they asked different community members to record how their travel plans change and different health outcomes related to those travel plans. And basically, they found that when people reported changes in travel plans, the odds of hypothermia and frostbite increased. And when people reported unusual weather that they weren't anticipating, the odds of unintentional injury also increased. And this is the type of it's not just like animals like caribou like you see on the screen here. It's also different berries and other more like vegetation type of sources of food. And so this elder from the Eastern Canadian Arctic talked about how the previous year they had no blueberries and how unusual that is, but how healthy blueberries are for you and how key they are to the environment. And she ended by saying, like to have no blueberries, it's unheard of, to have that happen. And there was a long emotional pause after that because it's not only a source of nutrition, but for Inuit, it's also a source of well-being and mental wellness. And it doesn't just impact the food on the land, it also impacts the food in the grocery stores. So if you have bad weather, which has been increasing from climate change, it's really hard for planes to land in those conditions. And it's becoming increasingly common to have weeks on end where planes can't enter the community. And when that happens, the supplies in the stores really, really drop. And so here you have somebody again from the Eastern Arctic describing a situation where the food sources that you usually get to, you can't reach, and there's not enough snow, there's not enough ice. It's alarming that we're just seeing the beginning of climate change. And when the weather's down for 5 weeks, how do you get food in there? I mean, their stock was just down to bare bones because there was no way to get food in. But the good news is that there are solutions, and Inuit are not just passive victims of climate change. They're actively working towards innovative adaptation strategies. And there's 4 different elements to this that I think are important to highlight. Inuit and other Indigenous groups have asked for self-determination in both research and climate action, highlighting the importance of Inuit knowledge, or for other Indigenous groups, Indigenous knowledge, the importance of community-led adaptation, and also climate health research that's led by Inuit to help inform some of this. And so I wanted to give one example of what that can look like in the Arctic. And this is a project in Nunavut. We call it the NSAP project for short. So basically, some of the initial work that we did here reflects some of the things that I already shared. So we know that food is really important for well-being, for sharing, for community connection and identity. So a lot of research to date, or until this project, had really focused on more of a male role in that. So what does it mean when like male hunters are out on the ice and out on the land, and they can't access the food that they usually access? The ice is too thin, it's very stressful to be out in those conditions, and it also impacts their ability to get food and bring it home and put it on the table. We also know that Inuit crave their country foods, their traditional food sources. They would rather eat country food than store-bought food for a lot of different reasons. And not just the increased price or the lower nutritional quality of the store-bought foods, but also the connection that food gives them to identity and who they are as Inuit. It's also, country food is very nutritious. There have been a lot of studies done in the past looking at how nutritious country food is, the foods that people get on the land in the Arctic, and how far superior it is to the nutrition of store-bought foods. And then finally, we know that it's really important for Inuit to have the access to the resources to be able to adapt and implement adaptation strategies that they have a leadership role in. So that brings us to our project. Because so much research in the past and also so many climate change adaptation strategies in the Arctic have focused on the male role in country food and how climate change is impacting hunters' abilities to get out on the land and access food, we really wanted to work with women, because women also play a really important role in the food system in the Arctic. And so our goal was to mobilize things like storytelling and cooking demonstrations and peer learning, enabling women to exchange knowledge on what they can do in the face of climate change and the impacts that climate change has on their food systems. So just as an example, so in the Arctic, we know that access to country foods is changing. But we're also seeing new foods pop up in communities that they weren't in before, while other communities are finding it harder to access certain country foods that they used to have access to. So some communities are getting new foods, and some communities are losing old foods. And so one Inuit identified solution to this is connecting women across these communities to share knowledge about, if one community used to have access to a key food species and they no longer have that access, but another community does, connecting those women to talk about how to prepare those foods, and also to help work across generations to share that knowledge as a climate change and nutrition adaptation strategy. And so why does this matter? Well, it matters because food security and nutrition is a top priority that's been identified over and over again in the Canadian Arctic. This approach builds social cohesion and also promotes intergenerational learning between generations. It also enhances adaptive capacity for these communities, and it really centers women's leadership and knowledge in climate change adaptation, which has been really missing in the Arctic to date in terms of the food discussion. So I'm going to try and share a video because I think it's really important. I'm not Inuit, I'm a white settler in Canada. I really wanted to share the words and the language of the women who are leading this project in Nunavut. So we'll see if the sound works, but Maggie, if the sound doesn't play, if you could just pop in and share the video from your end, that would be amazing.
Can do.
Okay, you should be able to hear some music.
There's no sound coming through, so I'll share it, Sherry.
Thank you.
Ani perokse hanginata perokto venonik asingin nilu perokse ago batonik taunane ophuyumi uwine hingi tamane ukyok takto meniki niki nakatego taimangale mai inu sitinne pimmario kitai inu hingi. So country food is very important in our daily lives because it gives us strength. What country food means to me, it means everything. It's my whole life. I have grown up with it, and I'm going to grow old with it, so it means everything to me. Paguli, inuina hingit, silabut malitsugu, ukangakut, ukiansakut, ukiukut, auyakullu, tamakua umajuit, niriugisori gattigu. Tatamaunga nunatino. Pimmarialo titabut, atsualo narigumajabut. Inu sitino, iluitu gutigi gattigu, inu iniringi. Our environment is changing drastically. We have to adapt to it. We will stay with our food. We have to. And because it's important for our future generations as well. And for our overall health. Ang nanong taman na pimariw mimman silaw as di palyani nga nihilo tamakwa kamagidaw so kuningin nagsiyo tiyo nagsaw mata ilangi aknay amuti nagsiyo katakalwang mitilogit umayo pinunig taman na ang nanong pimariw yok nihid kamagitsiyari akigatigo at gututsyar logit nihid. As women, we are the main people to look after the country food. We cook them, we know how to prepare them, we know how to serve it. Tabani, nakibut sila ulo as di parlianing anon ilagi daw mega matagwa so kwesiga so aksutig inuit nakinginig nakijaw sunig ang maluto ko sititsikan na kaso aksutig tamani ukyok taktumiugong ituning inuin na hingit pimmaryoning taman na hubiagi jaga silak duang miugo hatihot tukusikan na hulubig tao tamakwa inuit na hingit tabuna tapani piliriagayatini ikayutaw kaswang matan. So ENSAP had also taught me a lot about the importance of talking about our country food. The ENSAP project is so important. Someone has to do it, and women are the initiative.
Okay, awesome. So I'm going to try and take back over the screen and share my slides again. So you've heard it from the women themselves, in their own words and in their own language. And so what I wanted to just spend the rest of my time talking about was what our team sees as the success to the project, and that's partnerships. And so here's the larger team. But what I wanted to flag here is
Sherry, your slides are not up
no,
yet.
it's not. I'll try again.
There they are.
Is that okay? Awesome. So this was just the previous slide. Key to it is partnerships. So this is the team, and what's key for this team to point out is it's a collaboration of not just university researchers, but also the government of Nunavut, specifically the Department of Health, and our team has nutritionists on the team and other people from the Public Health Department. We also are collaborating with the Nunavut Research Institute and also NTI, which is an Indigenous organization that's responsible for upholding the rights of Inuit in the territory. And critically is the Inuit women who are driving this project. And so from the beginning, we spent a lot of time, actually years, developing a framework to try and uphold and do those partnerships in a meaningful way. And so we always wanted to respond to Inuit identified research questions, make sure that Inuit are guiding the research, making sure that Inuit ways of information sharing and research are centered at the project, and prioritizing knowledge to action. So not just publishing papers, which publishing papers is important, but it's not enough. Also working with different partners to try and mobilize this knowledge into their public health programs. We spent a lot of time also talking about project values. And so these are the different project values that we identified. So respect and open dialogue, intercultural learning, meaningful collaboration, active listening, community engagement, long-term commitment. So this isn't just a short-term project, this is a long-term commitment that we have to each other, as well as Inuit leadership in the project. And then we are mobilizing those values through different principles, including Inuit self-determined determination in rights and research, among many others, all the way to language and cultural continuity. So in terms of scaling up, when I reflect on the work that I've been doing with these amazing Inuit women in Nunavut, I think that these are the 8 things that sort of I take away with me, that if I were to do this again or to do this somewhere else, that I would make sure at the core of the partnership building. So that trust and long-term relationships, taking the time to build that trust, and also being willing to commit to the long term. Equity and power sharing. A lot of times research or even sometimes public health programming is very top down. So making sure that community members have the power in this space to lead. Cultural safety and respect. Co-development of the ideas. Mutual learning and capacity strengthening. So I know I've learned a lot throughout the process, for example, and so have the other team members. I think having flexibility and responsiveness. Things change day to day, month to month in terms of where people's priorities are at, what's going on in terms of health in the community, and being responsive to that. Implementing a shared vision and common purpose. And also care and relational accountability. So that's my presentation, and an example of how we've really prioritized partnership building in a project that actually the partnerships took years to develop and to get just right. And now the project's running really smoothly, and Inuit women are taking the driver's seat in the process. So thank you very much.
Mil gracias, Dr. Harper. Realmente muy inspirador la presentación que nos hace y sobre
Thank you,
todo
Dr.
el
Harper. It
proyecto,
was quite an inspiring presentation,
que
and also
viene
the
avanzando.
project
Creo
that
que eso
you
inspira mucho
are
interés, digamos, de lo
leading.
que
I think it's truly
implica esta
inspiring
sesión y
regarding
cómo se
the
construyen
topic of
esas
this session, and
colaboraciones,
also how we build
es importante las
partnerships,
colaboraciones como en el caso que usted está
and what
mencionando
is
del lenguaje,
important in
el saber de las
partnerships, such
personas,
as in
porque
this case, as you were saying,
compartir
knowledge,
con
people's
personas de
knowledge, being
diferentes
able to
disciplinas
exchange
y creo que pues
information
vamos
with
a
people
tener
from
bastantes preguntas para
several
usted
disciplines.
al
So I'm
final
sure we'll
de
have
la
a lot of
presentación.
questions for you
Le
at
doy
the
el paso
end of
entonces a la
all the
doctora Stewart para que
presentations.
nos
Thank you.
comparta
Now, I would like
su
to give the floor to
experiencia
Dr. Stewart so that she
trabajando
can share her
como
experience with
directora
us
de EI. Adelante,
while
doctora.
working as the IAI's executive director. Thank you.
Muchas gracias, Gilma. Voy a
Thank you,
compartir mi
Hilma. Let me
pantalla.
just share my
¿Lo
screen.
ven? ¿Ven
Can
la
you see my
pantalla?
screen?
Sí, te falta
¿Ahora
en
está bien?
presentación. Está
Yes.
perfecto. Ok.
Yes, we can see your
Muchas
screen.
gracias, Gilma, por abrir
Thank you
este
so
espacio. Gracias a todos
much,
los colegas
Hilma,
y
for this
realmente un
space. Thank
honor
you
y
to
una
all my
alegría compartir
colleagues, and
con
it's an
todo
honor.
el mundo que están
And
aquí
it's
con
really great
nosotros
to
hoy en día.
share this with all
Soy
the
Ana
people
Stewart
here
Ibarra,
today. I'm
fundadora
Ana Stewart
ejecutiva
Ibarra.
de
I am the
EI, el
executive
Instituto
director of the
Interamericano para la
IAIA, the
Investigación y
Inter-American
Convergencia
Institute for
Global.
Global Change
Y para
Research.
mí la cuestión de
And
colaboraciones en la ciencia, en esta
collaboration in
ciencia, política pública,
science,
diversidad,
public
ha sido mi
policy, and
pasión y voy a
society.
compartir un poco
This
en
has
este
been my
breve caso estudio
passion, and I would like to share
de
this
mis
brief
experiencias trabajando
case
con el nexo
study about my
latinoamericano.
experience
Bueno,
working with the
para
nexus
abrir muy rápidamente sobre cómo
between
llegué
climate,
al IAI.
environment, and
Antes de
health.
estar en el IAI, yo era
So, the
investigadora, era
IAI.
científica,
Before working
trabajaba
for the IAI, I
en un
was a
programa de
researcher.
investigación de salud
I
global
was
en la costa
working with the
sur de Ecuador y
global health
por
project
más de
in
una
the
década
southern coast of
trabajé
Ecuador. For
directamente
over
con la
10
Universidad
years, I worked
Geopública, el
directly with
Instituto Nacional de Meteorología,
the
Ciudad Local, Club de
National
Biodiversidad en Ecuador y a
Institute,
nivel internacional
the
para
Meteorology
realizar trabajos de
Institute
investigación
in
para poder
Ecuador,
entender los
and all
factores
other
que
international
estaban
institutions to
afectando el riesgo y la
research the
distribución
factors that were affecting the risk and
y transmisión de
distribution
dengue.
and
Dengue,
transmission
como
of
muchos
dengue.
conocen, es una enfermedad transmitida por mosquitos que tiene toda su
As many
complejidad y yo
of you
vine desde
know,
años de
dengue is
ecología
a
y de pensar en
vector-borne
sistemas.
disease. It's very
Entonces
complex.
fue una
And I
experiencia
come from the
muy
world of ecology,
enriquecedor
working with
que
systems,
en
and
el
it was a
fondo,
truly
digamos, en el corazón
enriching
me enseñó
experience. And deep
la,
down,
la importancia, como ya mencionó
this
Shirley,
helped
de
me,
que estas
as Shirley
colaboraciones
said,
de
it
base
helped me
partnership,
understand the
equidad,
importance of working
colaboraciones que realmente
together,
responden a las necesidades locales, que
partnerships
escuchan,
based on
es lo que
trust,
es fundamental para
equity,
poder
local
llevar adelante
communities.
trabajos de ciencia
This is
que tengan
essential
un
in order to
impacto en
do
políticas públicas o efectores
research
científicos
work
o
that has
cosas
an
que llegan
impact on public
desde
policy
local hasta
making
lo
or public
internacional.
sectors at
Entonces,
different levels,
con esa experiencia en
internationally, locally,
2019 yo he hecho
etc.
el salto desde
In
la Academia de Ciencias
2019, I went
a
from
IAI.
the
Y
Science
nosotros en
Academy
el
to
IAI
the
somos un
IAI.
organismo
And at the
intergubernamental
IAI, the
que hemos
IAI is an
establecido hace más de
intergovernmental
30 años
organization.
atrás
It
a
was
través de
created
un
over 30
tratado
years
entre
ago
nuestros
through
19
a
países
treaty
miembros.
entered
Y nuestra
into
misión es fomentar
by
la
our
ciencia
19
sobre
member
procesos de
countries. What
cambio
we do
global ambiental
is
para
promote
que nuestros países
science
miembros tienen
on
el
global
mejor
environmental
conocimiento,
change
herramientas y
so that our country members
experticia para
have
poder
the best
responder y desarrollar
knowledge,
soluciones para
tools, and
estos retos.
expertise to be able
Entonces,
to respond
nuestro corazón es mucho
to these challenges and
de
develop
colaboraciones entre
solutions
los
as
países,
well.
intercambios de
Therefore,
conocimiento,
we work with
cooperación
partnerships
y
among countries, we
colaboraciones
exchange knowledge, we
científicas, pero fuera de la
cooperate, and we
academia.
have
De hecho,
scientific
algo muy
collaboration, but
particular del
outside
IAI,
the
la
academia.
ciencia que nosotros nos enfocamos es ciencia transdisciplinar. La
At the
ciencia
IAI, and
transdisciplinar
this is
se
very
refiere a la
interesting, we
ciencia
focus
que
on TD
reúne
science.
los conocimientos
TD, or
académicos con conocimientos
transdisciplinary
fuera de la
science, brings
academia,
together
desde la
academic
sociedad civil,
knowledge
de comunidades locales, pueblos indígenas, desde el
it brings
sector
together the
público o del
academia,
sector
local
privado,
communities,
porque
indigenous
entendemos
peoples,
que
public
se
sector,
requiere
private
mucha
sector,
diversidad
everyone.
de diferentes formas de ver el mundo, diferentes conocimientos y
We believe
saberes
we
para
need
poder
this
realmente
diversity,
abordar
different
las
ways
problemáticas
of
y desarrollar soluciones concretas.
knowing about the
Y este
world,
enfoque en la
different ways to
transdisciplina
address
no es algo
problems in
que
order
yo
to have
decidí como
specific
mi
solutions.
objetivo, no, eso es algo
And
que
TD is
viene de
not
nuestros
something I
países
chose
miembros, es un
as
mandato. Nosotros como
as
ente
an executive
gubernamental
director.
pedimos a nuestros países
This
miembros.
was
Nuestros
decided
países nos
by
han
our member
dicho que
countries. We
es
have
el
a
camino que
mandate.
ellos creen que va a tener como la mayor
So
efectividad de
our
cara a la ciencia a
member countries
informar
believe that this is
las
the best
políticas
way
públicas en la
to
región.
help
Entonces, el IAI ha
science
trabajado
inform public policy
en los
making in the
últimos,
region.
especialmente en los últimos 15 años, para fomentar capacidades
In the
de la
last 15 years, in
transdisciplina,
particular, the IAI
desarrollar
has
redes
worked to promote
transdisciplinares en la región
capacity
y
building,
de capacitar
a
y
TD
financiar
capacity
proyectos.
building, also
Entonces, voy a
developing
contar un poco
networks
cómo
in the
hemos llevado ese
region
modelo
and funding
a trabajar
projects. I
en
would
las
like to
redes
tell you how the model has
intergovernmentales.
worked in order to address the CEH nexus. As I said before, we're an intergovernmental organization. That means that we report to our countries. This is the IAI's COP. We have an annual COP. The 19 members meet through the representatives appointed by the government, and these are the, I don't know, the science technology secretary, people from ministries, people from universities, etc. These are the focal points. We work with them so that science has a greater impact for the good of the countries. We also have three advisory committees: a science committee, a science and policy committee, and an international people's committee. This one was launched in May. It is very important when it comes to bringing indigenous knowledge, rights, and science into the IAI's agenda. I would also like to tell you that the IAI hosts the Belmont Forum. And why am I saying this? Well, the Belmont Forum is a consortium of science funding agencies from throughout the world. We are 132 members, 55 countries, and we have implemented 23 CRAs. And to be eligible to apply for those funds, you need to implement a TD approach. Also, you need at least 3 participating countries within the project, and also you need 3 funders. A few years ago, I think in 2020 or 2021, the Belmont Forum started developing a CEH CRA. It was the second one. The IAI participated in that CRA. We had to talk to our communities to make sure that our region's priorities would be represented in the call. And also we had to prepare our countries so that they could actually access these international funds, so that we would be able to have an international call like this requires the collaboration of different science stakeholders, experts in the region, civil society stakeholders, etc. So there was equitable collaboration from the very beginning. The Belmont Forum conducts scoping workshops in order to develop the CRAs. So the IAI led the scoping workshops in Latin America and the Caribbean. We invited several stakeholders to find out which were the priorities to be included in the call. Several topics came up. Our job was to see how we could respond to our community in order to prepare for the CRA, and also ensure that this was included within the priority pillars in the CRA being developed. As you can see, one of the first needs was the training need, capacity building. Here we're all here today. In 2022 was the first time when we met with the GCCHE, PAHO, and other partners to launch the first CEH climate and health courses, in 2022. I was so surprised at the beginning because there were so many people joining us. It came as a shock. There was huge interest and so much knowledge in the region as well. And there's a huge demand also. And that was the first experience. And I think this is the 6th course we have implemented with the GCCHE and the other partners. This showed us the importance of creating these partnerships in the region to be able to create a capacity building program that would address the needs in the region with experts speaking their own language. We didn't want foreign experts because we did notice that there was huge capacity, there were amazing capacities in the Americas, and the idea was to facilitate and protect this space as we're doing now. So this capacity building process started by focusing on creating TD teams, TD science team. The IAI doesn't implement adaptation actions, but we do support scientific knowledge production that might support public policy making or intervention actions in each country. After launching the first course, we launched a TD training program. We opened a call and TD teams applied. It was something like 124 teams in the September-November 2022 course. Each team had to include a biophysical scientist, a social scientist, and a non-academic stakeholder. That was the TD core, and they went through this TD training. They were trained on how to do what Sherlyn was talking about, how to conduct equitable collaboration, how to implement multinational projects with these diverse stakeholders, which were the good practices when it comes to analyzing and working directly with power and equity dynamics within groups, and also how to actually produce solid science to implement this science during the process. At the end of the process, the participants took part in an in-person workshop to receive additional training. We met with over 50 stakeholders from the public sector in Argentina. This was done jointly with the Neuquén government in Argentina, Patagonia. They were a local host. We had several people from the Argentinian government. It was amazing as an exchange. Scientists and other stakeholders were able to sit around the table, talk to decision makers, listen to their needs, and design the projects, because they were designing the projects at that time. At the end of the process, 12 projects were selected. 15 countries were represented in the final pool, and most of them are now closing the first stage of the project. The aim was to prepare the region, not just for this call, but also for the Belmont Forum CRA I mentioned before. And a huge funding wave, international funding wave in the nexus between climate and health. I'm sure you've seen the Wellcome Trust CRAs, IDRC from Canada, Canada Grand Challenge is also launching a new CRA next year. There is great interest in funding CEH science and South-led projects, Global South. That is. So it was very important to work with the communities to prepare them. Here we have Hilma, Mercy Borbo, Arsenia, many of the speakers we've heard, they participated in this process. We have learned that it's essential to invest in these preparation processes before a large call is launched. It's not enough to launch the call and have the funds. It's important to work with different stakeholders to prepare them for the call. If not, what we have seen for decades in the IAI is the funds are allocated to just a couple of countries, usually Brazil, Argentina, and Mexico, who have the best scientific infrastructure, others like Chile and Uruguay. And that's fine. It's great that they have science. But we want to make sure that all our country members have access to these resources. Also, people who are not in the capitals, who are in the communities, in smaller cities, they should be able to access the resources as well. Therefore, we are committed to science, equality, and equity, and accessibility, and access to resources as well. And it's also very important to have linguistic inclusion, and this has been a fact. always at the IAI. Our calls are multilingual. We have shared this call with the International Funding System. Within the Belmont Forum, we are piloting new platforms to receive proposals in English, Spanish, French, and Portuguese by using AI tools. And this is the final slide. Hilma. Finally, as I have said at the beginning, collaboration is my passion. In the last 5 years, I have worked with a very close friend, Desiree Laborde. We have written this book, or compiled it, Transforming Global Health Partnerships. Here you can read about the stories of over 90 authors from 96 countries around the world. It's a free book. The idea was to compile stories about how we can transform this extractivist colonial model and the problems we see globally in order to keep making progress. And what colleagues from around the world told us is that, as Shirley has said, these relationships built on trust need to be addressed. We need to actually showcase potential inequalities. And these human relationships nourish us and help us move forward amidst the huge challenges we have in the world and also regarding global health. So please read the book. It's completely free and online. Thank you so much.
Thank you so much, Anna. Thank you for your presentation, for bringing this perspective different from what Dr. Harper showed us, because here we can see how partnerships can happen between different institutions, different bodies. And I think the IAI has been able to bring all those elements together so that collaborations have an actual effect and impact on what we want, to bring trainings to the region, but also from those trainings to have people come up with solutions for our regions in order to improve our conditions, of course, despite the challenges we face with climate change. Thank you. And now I would like to welcome Gislani Mateus, who will share her experience from the city of Rio de Janeiro.
Hello, you all. Can you see my presentation there? Yes? Yes? Okay. So I would like to thank you for the opportunity to be talking here to you all about this experience in the city of Rio de Janeiro, the way we have worked towards adaptation, including all the different risks of our world in terms of climate change. But I would like to speak a little bit about the city of Rio de Janeiro so that you can understand the case study which is going to be presented in terms of how the city is adapting itself and also promoting partnerships to deal with those risks and those cases of emergency. The city of Rio de Janeiro is the second largest city of Brazil, with over 6 million inhabitants. It actually gets a significant flow of tourists every year. 22% of our population, they live in the favelas, in the slums, so areas of significant social vulnerability. And we also have a humid tropical climate, which is very, very characterized by high temperatures and high level of humidity. So we are a very hot city, and we are a coastline city as well. So we have coastline and we have beaches. So in general, we have always had as a climate risk major rainfall, arboviruses and epidemics like dengue and chikungunya, and recently heat waves, extreme heat waves, breaking records that we had never had in our city until recently. I organized a little bit of the things here, but I think this group already knows about those risks and how climate change is in fact a risk for health, and how much it's actually generates emergency cases of public actions like heat waves, huge rainfall and all those different ecosystems that create damages to physical health inequity, generating also processes of social inequity, health inequities, and those risks will add to the risks of infectious diseases, but also chronic diseases and non-communicable diseases, which become acute during that period of time, and also all the social issues around it. So more and more, it is necessary that the cities work and that the cities are capable of adapting themselves and build resilience to adapt to those risks, trying as much as possible to reduce its impact in terms of quality of life. Those are major challenges indeed, but in fact, this is a reality. This is something which is more and more needed. So now trying to build health resilience, talking about building health resilience, I'll be talking about some recent experiences we went through here in Rio de Janeiro. But in a nutshell, I think it is important that when I talk about a city, is because I'm talking as a professional, a municipal servant. I work in the city of Rio de Janeiro, and I have had an experience of 16 years in this. And this is something that has always been very remarkable to me, because during my first year of work as a nurse, I spent more than 2 weeks with 300 families in a school, and they were sheltered there because they were displaced because of the tremendous rainfall that we had there in a big area of the city. So over these 16 years, many emergencies of public health, I went through them all. Quite a lot of problems of hydrological risks in Rio.
De doenças transmitidas por vetores e, mais recentemente, o calor extremo.
Of course, we're talking about vector diseases, most recently extreme heat waves. Now, talking about the communities, it is important that everybody has an idea and have a map of the vulnerability of each town, each city, because geography, reality, social context, they're all different. It is important, nevertheless, that all vulnerabilities and climate health interactions and risks are known by the community so that we can plan our adaptation. We've been working on the integration of health and weather with different teams, resilience teams, weather teams, so cross-cutting work in a more integrated fashion. Of course, we have to strengthen our services. This is extremely important, principally during these times of craving for actions and with this need, because we are living through an emergency time. Make sure that we are providing services, but also make sure that the community is part of this plan. It is important to have surveillance systems and, of course, early warning systems, so to be able to be all there and ready when action is needed. And of course, we have to talk about investments, principally to trigger rapid response, to reduce risk, to reduce hazardous situation, of course, to build our resilience. Now, let me talk very briefly about our last events. There was a huge flood in Acari, which is a neighborhood, a vicinity in Rio, and this is a hospital parking lot. Of course, they had to shut their doors because they were victims to this horrible flood. Here in Rio, we are working on our preparedness in our health system. We have alarms, principally in slum areas, because they are at risk of landslides. And of course, we have a plan. We have an integrated protocol with different stages. The population knows how to behave depending on the signs that they receive. And of course, we have an integrated protocol to trigger health measures. Now, with regards to the preparedness and alert and response, we have an entire team and equipment so that when we have an emergency situation such as a flood and people who would not who were not connected, we got organized with responsive teams within the community. And you have here some examples of that very moment. With a mayor, we have a response center to provide help for both health and civil defense, all integrated, and of course, providing people and equipment for visits before, during the emergency, and of course, after the event. The idea was to decrease of course, the number of people who were affected and articulating the entire team, providing social defense, health, and care to the families that were affected. Of course, it is important to mention that we have our SUS, which is worldly known, and it is universal, and it is for free, and it is an equipment that we count on, and that provides a lot of resilience. And here in Rio, we have health teams. Those are people who take care of, on average, 3,500 people. So this is for primary care with community agents that are, as a matter of fact, members of their own communities. These are extremely important tools for us to be able to make sure that our city and our community is totally connected. Now, with regards to dengue, in 2024, we had a huge number of cases. That's why it was extremely important, our early detection. We were working with health data, weather data. We were able to anticipate our epidemiology scenario with 2 months ahead. So that was extremely important to be able to increase our resilience. Of course, we wanted to prevent the disease, but of course we know that the vector is extremely challenging to us. We were living one of the hottest winters in record. We had other cases of dengue, but that was something that really left us surprised because of the weather change. So the rapid detection is extremely important for us to be able to get ready and provide the right response. We had the risk and communication and messages increasing our forces in areas that were more at risk, principally with regards to the control of the vector. So that was a way to, as a matter of fact, provide us power to be able to confront the epidemic. And then in February, we started, which is much ahead of the peak time of dengue. So that was extremely important. Despite of the number of cases we had, as a matter of fact, less deaths. With regards to all the capitals in this country that were an emergency situation, that was not only a problem of Rio itself, we had, as a matter of fact, the lowest lethality among recent epidemics. Why? Because we were really we were organized, and we, of course, combined meteorology, health, and health team, so to get actions connected with the participation of the community. Most recently, we had to draw up a protocol for extreme heat. The city of Rio has a sustained development plan, and we are working on the mitigation and adapting with increased of green belts. Nevertheless, in November 2023, had records never heard of, records of temperature. And we monitor our temperatures for more than 25 years, and that was actually widely known because there was a large concert in town, Taylor Swift, and there was a young lady who died, and that was a show, the Taylor Swift show. So the girl died. So if we had a protocol, that event would have been canceled if we had a protocol. So based on this event, we created this protocol. So we therefore united health, weather, and resilience and climate teams. And based on this evidence and this study, we show that there are several indexes that increase our emergency response. Based on that, we are able to define a protocol. Of course, I don't want to give you details because of a lack of time. Nevertheless, I would like to just mention that this protocol works as follows. We have data from the weather. We have data from our health system, from hospitals, from ERs. So all those data are in a database with a dashboard, and this heat dashboard gives us information at real time and gives us also an estimate of forecast of heat waves in the city of Rio. Based on this exercise, we calculate how many hours of extreme heat that would be affecting the population, and provides us a forecast with the following days, along with our health and mortality and monitoring services. We provide good tools to define 5 levels of heat. We have 5 levels of heat. So we are permanently monitoring heat waves in the city of Rio the same way we used to do, and we still do, for rain. So we have 5 levels. First level is normal routine. Second and third levels, we have risk communication and preventive guidance. And in the fourth and fifth levels, which are more extreme weather, there is an entire protocol of 200 actions for both health and environment and safety, education. So, of course, the routine changes. Public centers, cooling centers for the population that is in need, they are open. They open their doors so that people can cool themselves, can go inside and get a lower temperature or the AC. And so, of course, we trigger protocols to monitor risk groups, people who live on the streets, homeless. So they receive attention, and of course, pregnant women receive more attention. So they are also primary care centers operate as hydrating centers. And of course, the routines of those workers in the civil construction or health servants also change their routine, principally for those workers who are more exposed to heat. There is also adjustment in the routine at schools. Events could be adapted or even canceled, such as what happened when I just mentioned Taylor Swift. There was an event, and our pre-carnival celebration that has also been canceled this year, based on this protocol. So those are measures to decrease the risk for the communication to be exposed to those heat waves. So very briefly, there are several aspects of this protocol, but of course it is important to consider several different sectors and of our project. What we call pre-carnival, which is very popular in the city of Rio and throughout the country. There are many people in the celebration. So in our pre-carnival 2025, people were already in the rhythm of samba, but then there was the alert, the forecast or an estimate of extreme weather. There was risk communication that was conducted by the city mayor. There was a press conference to disclose how much we would be exposing ourselves and the risk that we would be subjected. So the idea was to let the entire community know about the centers of hydration and the cooling centers. There is also an app, Rio Operations Center, showing to all, the entire community where they would look for help in case of being in a vulnerable situation. And of course, a list of things of do's and don'ts. There were also alerts that would be triggered on the app, through the app. So as a matter of fact, on the 17th of February, we reached level 4, which triggered, well, differently from what happened in 2023, we would have alert at real time, disclosed to the entire population. So we open a real-time alerts, the public campaigns, and of course the cooling centers would be open. There were 58 points, and also the adaptation at the events. We were talking about the hydration points, and we therefore strengthen our public health teams, and we changed the routine of all workers. We would be on the street or working in the civil constructions. Of course, those were examples of how to increase our safety. Those are just as examples of how we're in the city of Rio building our resilience. And of course, it is important to count on plans and protocols to make sure that there is more resilience in our city during these moments of extreme weather. And of course, considering this ecosystem, principally with regards to the adaptation and climate resilience, considering that risks are there and already happening. This is the website with some papers that I just made reference to, so you can just check. This is my email address. Thank you very much for the opportunity.
Mil gracias a todos nuestros conferencistas. Les agradezco
Thank you so much
prendan
to all
sus
speakers.
cámaras.
I would appreciate it if you turn your cameras on.
Y tenemos
And we have
escuchando?
several questions. Can you hear me?
¿Me escuchan?
Yes.
Bueno, vamos a dar inicio
And let's begin
entonces a la sesión de
with
preguntas para la
the
doctora
Q&A
Harper.
session.
Una pregunta,
For Dr.
y
Harper, we
dice,
have a
usted
question
comenta que algunos
that
tipos de
says,
alimentos ya no están
you
disponibles y
said
otros
that
sí.
some foods are
En
no
la
longer
salud
available and some are. Sorry, she's cutting off.
aparte la pérdida de nutrientes por la
And
pérdida en
aside
relación con los
from
nuevos
the
alimentos
loss
a los que las
of
demás comunidades no están
nutrients,
acostumbradas.
is there other issues because of foods they're not used to?
Doctora Harper, ¿me escuchó?
Were you able to hear the whole question?
Yeah, sorry, I was just waiting for the translation to come through. Sorry for that pause. Yeah, thanks for the question. I think I understood the question fully. So yeah, there's some foods that aren't available and some foods that are available. An example from the Eastern Arctic, from Nunatsiavut in Northern Labrador. For example, communities no longer have access to hunting caribou, but moose have started traveling further north. And so these are two similar animals, but very, very different. So for example, moose are a lot bigger. And so this has required communities for men who are hunting, for example, to completely redesign the komatiks, the sort of like the buggies that go behind the skidoo to carry the meat home. And so, and it also requires new knowledge and new ways of preparing that food for the women. So that's an example of it. And then I think that the second part of the question was about like changes in nutrients in those foods. I think so ultimately, I think that country food is just the safest option, or the best nutritious option. Studies have shown that over and over again. So even if foods are traveling further north, it's still really, really high quality nutrients. And was that the question, or was it about contaminants? Or sorry, or maybe I answered it.
No, muchas gracias.
Thank you.
Ahora
Yes.
tenemos una pregunta para la doctora
And
Ana
now we
Stewart.
have a question for Dr.
Nos está
Anna
preguntando
Stewart.
que basada en su experiencia en
How,
capacitación
based on
transdisciplinar
your experience on transdisciplinary training
en comunicación científica,
on
matemático y
science
ambiente, quisieran
communication,
saber cuáles son las
I
estrategias que
would
usted
like to know
recomendaría
what
para
strategies do you
diseminar las acciones
recommend
prioritarias que se
for
deben tomar en casos
disseminating
de
priority actions
emergencias,
to be
de eventos
taken in
extremos.
case of extreme weather events? Well, maybe Gislani would be better suited to answer on communicating measures, but I can speak on how we work with our scientific teams to foster communications, which has much more to do with my role. And so we work with the roles, the teams we work on to train them. We work with a team that is called Latin America 21. It's a group of journalists, and we have made several courses. I included a link in the chat where you can find that course on science communication. And these scientists write editorials that they are then spread in different publications throughout Latin America. And we have also printed some books. We had one this year on biodiversity that I can share in the chat, another one on climate change before. And so in our experience, communication and science communication is very interesting. And in our virtual campus, this is the course that has been taken by the most people. And in my perspective, it's not that all scientists should become excellent communicators, but we need to know the basics and we need to work closely with communication professionals. We need to build partnerships with them to ensure that the most important communication can reach, the information reaches the communities. Because, for example, this week I was at a meeting of the UN and there were some intergovernmental reports and there was little to no dissemination. Our governments in Latin America have no access to this. The briefings are 60 pages long or more. A lot of the information is not in Spanish or the other languages. Even if it is, it's a 60-page report. And so we need to work on that, on communicating in different languages, but also to different audiences. And at the IAI, we see that as a priority, but of course, there's a lot to do. It doesn't specifically reply to the question that was asked. I think Gislani is better suited to answer that.
Well, communication is a challenge, and in fact, this is something very, very much important when we talk about public health. Can you hear me? You hear me? Yes, yes, okay. Thank you.
A comunicação é extremamente
So,
importante
communication is of
processo
utmost importance
da emergência de saúde
in
pública.
this process
Aqui
of
nos nossos
public health
planos de
emergency.
contingência para
In our
emergências, a gente inclui
contingency
plano de
plans for emergency, we
comunicação,
include a
porque são
communication
várias
plan as well,
estratégias. Como
because it's
enfermeiro, não
many
somos
different
profissional de
strategies. As a
comunicação,
nurse,
mas eu
I
acho
am
que é
not a
importante
communication
dizer
professional,
que
but I
nós
think it is
temos
important to
profissionais de
say
comunicação
that we
também
have
nessa construção dos
communication
nossos planos.
professionals in the building of our
Então, algumas
plans. They are taking
comunicações de
part of
riscos
that.
foram feitas
Some risk
através de
communications were
jornais e
put
conferências de
forward by means of
imprensa,
newspapers,
alertas
by press conferences,
automatizados para chegar no celular
automated
das
warning
pessoas,
systems to
mas
reach
também
people's mobile
times de
phones, for example,
comunicação
but also
que, por
communication
exemplo, nós temos
teams.
redes nas
For example, we
favelas que
have
são de
networks in the different
comunicadores que
slums or
compartilham com
favelas,
aquelas mesmas
which are networks
pessoas.
of
Então,
communicators who
isso foi muito
share that
importante
information
para a
with the
gente estar
same
vivendo
people
os
around them.
desastres
So
também,
this is very
trabalhar
important. When
essa
we go through a disaster,
comunicação
it's important
para,
to
na
also work on
realidade,
this
fazer
process of
o alerta de
communication
risco
so
chegar
that we
a
can
todo mundo
actually
que precisa.
cause the
Então, são
warning
múltiplas
alert, this
estratégias.
risk
De
alert to
fato, elas
reach people,
precisam
and
estar
they
contempladas no
need to
nosso plano
be
de
included in
contingência
our
de
contingency
emergências.
plan
Então, a
for emergency
comunicação,
purposes.
assim como
So
vigilância em
communication
saúde,
as well as health,
assistência em saúde,
surveillance,
também é uma área
healthcare, and these
eixo
things,
do
this
nosso
is
plano
also
de
another
contingência
axis
aqui na
of our
cidade do Rio de
contingency
Janeiro.
plan in the city of Rio de Janeiro.
Muchas gracias. Bueno, yo quiero un poquito,
Thank
digamos, ya
you.
estamos cerca al final.
And
Quiero
we're
hacerle una pregunta
approaching
para que
the
cada uno de
end
ustedes
of the session,
dé
so
su
I would
respuesta.
like to
Y es,
ask a
¿cómo
question
abordar
to
la
each of you.
sostenibilidad
Uh,
para poder
and it's
mantener estas
how can we
colaboraciones y
achieve
estas sociedades
sustainability
para
to
mejorar
keep these
las
partnerships
condiciones de las
to
comunidades
improve
en
the
ese
conditions
ámbito,
of communities
digamos,
in
del cambio
this
climático? ¿Cuáles
context of
serían
climate change?
sus respuestas frente
What
a
would
cómo
you
lograr
say,
sostener
and how
que
can we
estas
keep
alianzas
or
se
maintain these
mantengan en el tiempo y
partnerships
que sigan generando
in
los
time
efectos que en este momento
so
ustedes
that
han
they can
mostrado con sus
continue
ejemplos y con
to
sus estudios
uh,
de caso?
give
No sé quién quiera
the
empezar.
outputs and outcomes that you have mentioned. Who would like to go first?
Doctora
Yo puedo
Harper, si
entrar.
quiere.
Dr.
Ah, bueno,
Harper
listo, Ana,
Pero
si quiere
or
decir.
Anna?
rápidamente voy a decir financiamiento. Sé que es un
Oh,
tema que siempre
I'm going to
hablamos
say
y yo siempre
funding,
a veces
very
pongo
quickly
mi
funding.
sombrero desde la
I know it's
financiación
something
de la
we
ciencia, financiación del
mention
gobierno,
a
adaptación
lot, but I'm
de
going to
región
wear
del
the
Caribe y
hat
Florida hay un
now
enorme
to ask
vacío en
for
medidas de adaptación,
funding for
mucho menos
science.
en espacios
In
de
Latin
salud
America, we still
y
have
tiene que haber
gaps
un mayor
there, especially
compromiso a
in health,
diferentes escalas.
and we
Aún
need
así,
bigger
con la
commitment
ausencia
on
de
different
mayores recursos
levels.
de financiación,
But even
lo
with
importante es
this
invertir
lack of funding, the
en las
important
redes
thing is to
existentes,
invest
mejorar los
on
recursos y el
existing
potencial no es solo
networks,
financiero
to
de apoyo a
provide
las redes de las
resources to
comunidades,
support
ese
networks and
tejido social que
communities. And
realmente
it's
en el
not
último
just about
tiempo que
money.
surgió, ese tejido
In the
social es
book
lo más
that I
importante.
shared,
Los
that
fondos son necesarios, pero también hay otras formas de
social
sostener ese
network
tejido
is
social que
what's
necesitamos
important.
urgentemente nutrir y sostener.
That's something we need to nurse and sustain.
Gracias, Ana. Doctora Harper.
Thank you, Anna. Dr. Harper?
Yeah, I totally agree. Funding was definitely at the top of my list too. And so I'll just add to that, say funding. And in the context of the presentation that I shared when working with Indigenous people, I think that upholding Indigenous rights and taking a decolonial approach is also like really key, because if you're not addressing like the root causes of inequities like colonialism, then might lead to maladaptation. So constantly like upholding Indigenous rights throughout the process is really important for that long-term success of the project and of the partnerships.
Eu concordo bastante
I
com a
fully
Ana
agree
e a
also
doutora
with
Harper,
Anna, with Dr.
porque
Harper
eu
as
acho
well,
que
because
também é desafio,
I
né?
think it
Todo esse
is indeed a
processo de
challenge. In
financiamento,
other words, all this
incluir
process
as
of funding,
comunidades e também as
communities
melhores
have to be
evidências, principalmente quando a gente
involved
tem
in,
pouca
especially having more evidence.
comunicação,
When we
pensando
have
em
little
partes mais
communication,
práticas, né?
it's important for us to think
Falo
about
como cidade,
practical
então
things. I
as
speak
cidades elas
as a
têm
city
as
because,
políticas
for
públicas e eu
example, the
acho
cities
que
have their
é
own
importante que
public
isso esteja
policies, and it is
incorporado,
important that all
né,
these
nos
things are
serviços
included or
públicos,
embedded
né, de
into the public
cidades de uma
services
forma
of the
orgânica.
cities
Só
in
que
an
falando até mesmo
organized
dessa
way.
experiência, nós tivemos
And
inclusive
even
que
by talking about
desenvolver
that
o
experience,
método
we had to develop a
científico
scientific
epidemiológico
method, an
que
epidemiological scientific
funcionasse, que
method,
visse realmente
to
as
work
melhores
well,
evidências.
that would
Então
actually
eu acho
look at the
que
best
o
evidence in these
Brasil,
things. And
o
so
Rio foi a primeira
I
cidade
think
do
that Rio de
Brasil a ter um
Janeiro was
protocolo
the
de
first
saúde
city in
extrema,
our
né?
country to
Então
have a
eu
protocol
tenho
of
visto
extreme
quanto que
heat.
agora
And I have seen
está sendo
how how much pre-COP30 this is also being developed by other places, and this is being discussed. I think, yeah, funding is very, very important for the cities and for the population that might also enjoy those services and that care. And also, it's important to think about the reality of the whole chain, because this goes from preparation, warning, alert, and a way of responding and how to adapt to these things. I think it's many challenges, especially thinking about the countries in the Americas in general. Thank you.
Well, thank you so much to all of you for your great presentations and the messages that you have left us with on the importance of having partnerships, having networks, having people, institutions, organizations that will facilitate this taking actions when dealing with climate change to improve conditions for communities. Of course, as it was mentioned, we have funding issues, but we have people, and we see in this course a lot of people who are willing to position this issue as important, and how we can also work on the other capacities that we need aside from funding. And as Dr. Harper was saying, trying to attack the root and structural causes of the issues. Thank you so much. And I expect to see all of you on Thursday for the last session. I hope you have a great rest of the day or night. And in solidarity with the people of Jamaica, I am hoping that the damage is not what has been projected. And thank you, everyone. See you.